There has been a lot of controversy about the Affordable Care Act, what some call Obamacare. There are the intense politics and the many computer glitches making it nearly impossible for people to enroll. But for American Indians and Alaska Natives, the issue is another story. Native Americans have a right to health care. The United States promised to send doctors to tribes that sign treaties in exchange for peace and for titles to lands. But the entire history of health care in Indian country has been defined by shortages. A modern network, the Indian Health Service, was created in 1955, and over the following decades, clinics were built, doctors were hired, and health care for Native people improved. But still, the agency was never fully funded. There was never enough money. When Medicare and Medicaid were enacted into law in 1965, there was no consideration about how these programs would impact American Indians and Alaska Natives. The Indian Health Service could not even bill the agencies for serving eligible patients. American Indians were left out of health care reform. That history of shortages is critical context to understanding the Affordable Care Act, because from the very beginning of the legislative process, the Affordable Care Act included Indian country.
Well, so let me tell you why it was different this time that Indians were included in a national health bill. Because we've always, for like 19 years, have been working on trying to get the Indian healthcare reauthorization in place, and just really couldn't get the traction that we needed. And when the country started to talk about, once again, taking on this big project of having to have a national healthcare plan, we were sitting at NCAI at a board meeting, tribal leaders around the table, and we said we really have to engage in this health debate this time around. And, you know, there were those in Indian country that said, no, you know, let's just stay where we are. We've been working our angles. We're trying to attach our bill to anything that we can. And we really urged them, our tribal leaders, to consider it. And Jefferson Keel, President Jefferson Keel, really knowing the healthcare industry probably better than many of our, you know, NCAI presidents in the past, et cetera, he agreed. And he said, yes, we should do this. And so we immediately started to look at the overall healthcare bill and working with the members of Congress to be able to find all those other places that it was important to insert N tribes. And so not only did we get Indian healthcare reauthorized permanently, but we were able to get the provisions in the Medicaid. We were able to get the tax exemption. We were able to, you know, just include a lot of places where tribes should have been considered and probably wouldn't have been if we didn't integrate those two pieces of legislation together.
So if the Affordable Care Act includes Indian country, the first question is why? American Indians and Alaska Natives have a treaty right, a statutory call to health care that transcends this latest national experiment. But recall the history of shortages. The Indian health system has never been adequately funded. Imagine this face as the Indian Health Service after receiving its annual appropriation from Congress. It's not even half full. But the Affordable Care Act opens up new funding. Money from Medicaid, money from tribal insurance, money from exchanges, new money, funds that do not have to be appropriated by Congress. Real money for Indian health.
Affordable Health Care Act is a very good thing for Indian country, a very good thing for Indian country. We have access now to more resources than ever before. And so, so this access to the resources is going to allow us to expand our services if we treat our healthcare clinics like businesses.
But to get to that much needed money, American Indians and Alaska Natives have to sign up. Sign up for Medicaid, sign up for tribal insurance, and sign up through the exchanges. This law is confusing, but it's the only way the Indian health system will get more money. I'm Mark Trahant reporting.